Hi everyone, Patrick Lynch here with Trillium Health Solutions. Today I'm here to speak with you about our individualized immune support formulas for helping the body combat Lyme disease and helping um, people with autoimmune challenges to put them in remission that are potentially caused by um, pathogenic triggers. So basically, before we talk about a little bit about the individualized formulas, I would just like to invite you to check out the blog post on dietary modifications. I know I stressed dietary modifications on the intro uh, video on the first page, but dietary modifications are the key. It's the foundation for this protocol. If you can't get on board with dietary modifications and be impeccable with them or close to impeccable with them, then this protocol may help you, but it's key to have those dietary modifications. And the reason why is because if we eat the wrong thing just once, then it can cause an inflammatory cascade, cytokine reactions, um, mast cell activation syndrome, histamine reactions. Um, and when we have an inflammation reaction, then it prevents circulation to those areas where the biochemical properties of these herbs, where they need to go to help the body go after these pathogens. So by keeping the inflammation down, these herbs can do their job. It makes, I'm, I'm sorry to say, but you can't go eat an ice cream cone and then just go eat a bunch of turmeric or take some anti-inflammatories. You're going to have a systemic uh, mast cell activation syndrome response or a cytokine inflammatory response. You can help it, but you're not going to stop it. It just won't work. So if you're serious about helping yourself put Lyme in remission, you have to be nearly impeccable. And by what I mean is in terms of nearly impeccable with dietary modifications. That means you just can't cheat any more than like probably once every 3 weeks. And if you do, it should be on accident. And you will likely make accidents until you really get it. And you'll probably make some accidents for, the first month or 2 months until you really understand how the body metabolizes certain things. However, that dietary protocol that I have on the Trillium blog is extremely thorough. And if you follow that, then you should be good to go. So a little bit about these formulas. Spiroclear 1 and Spiroclear 2 are designed to go after, to help the body, I should say, go after spirochetes, fungus, mold, yeasts, candida, and so forth. I'll talk a little bit more about them on each individualized um, link for each formula, but they are both very powerful formulas that use the best herbs that I have researched and used clinically to help the body go after the infection specified. Intracell 1 and 2 help the body go after co-infections, intracellular organisms, malarial types of organisms, Babesia, Bartonella, Ehrlichia, tularemia, pathogens like that. These pathogens are very prominent in the United States as well as all around the world, especially in the warmer regions. I don't know so much about the colder regions. It's likely, but like I said, I just don't know. Um, However, these intracell 1 and intracell 2 are designed to go after co-infections, intracellular organisms. and they are created to offset resistance. It can take some time to help the body become clear of intracellular organisms. And even though your symptoms might be gone, I would strongly suggest considering going about 4 more months from when your symptoms clear up to make sure they're gone, or even longer, because you don't want these bugs coming back. And if they do, then you just get back on the protocol. But I strongly suggest to, take your time, do things right, and do it the right way the first time. That's what I did. I took 8 months. Um, protects the liver and the kidney. It protects our vital essence. It protects the liver from liver irritation, leading to liver inflammation, leading to liver fibrosis, leading to liver cirrhosis, and then eventually cancer. So basically, milk thistle and ashwagandha. Ashwagandha protecting our vital essence so we don't end up with adrenal fatigue during or after um, combating Lyme-related infections and or autoimmune disease triggered by pathogens or potentially triggered by pathogens. So immunity is a formula that we designed to boost the body's energy. People who experience a lot of fatigue, immunity is designed to um, help boost our energy without boosting the pathogen. It's a very excellent formula. People love this formula. Breaker 7 is used later on in treatment, like around month 5 or 6, after the mess is cleaned up during SpiroClear 2. Breaker 7, just 1 cup of tea, will break open cysts inside the body. And you have to, I would like to say it's good to have the body cleaned up as best as possible before you start breaking open cysts, because you can develop a strong reaction from letting out the bugs. And you want to chase, there's a science to that, and we'll talk about it later, but Breaker 7 is a very powerful formula, probably the most powerful formula to use to break open cysts and dissolve biofilms and get into these hard to reach places to get the remainder of the bugs that you have while fighting a Lyme-related disease. Now, this is only for practitioners, practitioner use only, and it's only used for not only practitioners but trained practitioners by myself. If a practitioner wants to use this formula, they must contact me in order to use this formula, and we have to have a conversation about it, and then they need to sign off on it to make sure that they know how to educate their patients correctly on how to use it. Our fisetin product is the herb Zhao, which contains a high amount of fisetin, fustin, and protocatechoic acid. This is an excellent formula for helping to clean the blood vessels. These pathogens, Bartonella, Babesia specifically, they like to get into the lining of the blood vessels behind the atherosclerotic plaques. These pathogens can dig behind the plaques, get into the blood vessels, cause harm to the blood vessels, and it can be really hard to bring the biochemical properties of intracell 1 and intracell 2 to these areas if there are atherosclerotic plaques. There are herbs in intracell 1 and 2 that help strip away these plaques and help strip away the mucus layers that these pathogens create, like Qingpi, Huopo, as well as other herbs. And there are some strong blood movers that help dilate the blood vessels, help guide into the capillaries, and so forth to help get to these hard to reach areas. Zhao and fisetin also guides to the brain, helps to break down amyloid plaques, and helps to get in and under those plaques to get to those areas of the brain where more spirochetes are. And it's also a very strong anti-parasitic antimicrobial, and will help the body go after pathogens in the brain. As well, it will help guide the antimicrobial properties of the other herbs to the brain. So, Bicol skullcap and berberine 300, basically it's the same herb, and we'll talk a little bit more about why there are two names for these herbal formulas, and they're not formulas, it's just a single herb powder. Bicol skullcap is the very strong herb. It's in both Spiroclear 1 and Spiroclear 2, so it's not really necessary to take this herb. People like to buy this herb just to have it on hand because it's a very strong antimicrobial, and it's used for several things, so that's why we sell it. So in a nutshell, that's a little bit about our immune support formulas. So if you have any questions, please shoot us an email at trilliumgp@gmail.com. All right, take care.